My name is Brad J. Larson. I'm an MD. I practice orthopedic surgery in Logan, Tremonton, and Brigham City. In our area, it's interesting, we have sort of a biphasic type of population. We have a very young population, so we see a lot of active individuals injured in very active type sports activities, skiing, snowmobiling in the wintertime, baseball, basketball, football, etc. So we see a lot of young people with injuries that come in that need help and assistance to restore their function. On the other hand, we have a lot of elderly population. We have a lot of people who live to be very old in Cache Valley. The Alpine Group stays on top of the latest developments in the care of orthopedic and other physical medicine injuries and treatments. We're able to communicate amongst the group and have a lot of specialists and subspecialists that can help deal with most of the problems that would come into the door. One of the big issues that I see in my practice are young people who come in who have an injury to their joint cartilage. The joint cartilage is a very special tissue, and basically when it's worn out, then you have arthritis, and then you may end up with an artificial joint. So in a young person, we want to try and restore that cartilage surface so that they can live a long life with their own cartilage would be the ideal. And our present treatments are good, but they don't really restore your normal cartilage tissue. Well, I'm a principal investigator on a new technique that's been developed. It's presently been in Europe since about 2009. And it's trying to be introduced into the United States. So it's a phase 3 FDA study, and I'm one of about 20 principal investigators around the country. And it involves cartilage restoration procedure. So it would be more for the younger person who has a cartilage defect in their joint, specifically the knee at this time. It's a new technique that's evolved to help restore their cartilage back to its normal condition or as close as possible to that. And it actually involves biopsying their cartilage and sending it back to a laboratory and have them actually grow their cartilage back, have them grow it back again into this, break it down into the cells. They'll implant that into sort of a sponge. It's called a scaffolding. So they send it back to us about 3 weeks later, and then we take that sponge and actually sew it back into this defect after we prepare it. And then that will grow back into the patient's own cartilage and restore that joint function so that the patient can hopefully return to activity more quickly, and that joint hopefully will last them many years, if not their lifetime.